Hello everyone, greetings from Shekhar Eye Hospital. Welcome to this YouTube session with me, Dr. Archana Singh, Senior Consultant at Shekhar Eye Hospital. So what is our topic today? It's about eye allergies. Can you think of one common problem in the eye which can be really bothersome? I'm talking about itchy eyes. Itching is a very common symptom in the eye which can be really bothersome to the individual. There are various causes for itchy eyes. Eye allergies being one of the most common cause. Why did I say it is bothersome? The reason is this. When we have itching in the eyes, we generally tend to rub our eyes. Rubbing will release a lot of chemical mediators in the eyes, which can further increase the itching. So this itch, rub, itch cycle goes on until you know the cause and take the right treatment. Today in this educational video, I will be talking to you more about eye allergies, the causes, symptoms, tips and remedies, do's and don'ts. So stay with me and know more about your itchy eyes. What are eye allergies? It's also called as allergic conjunctivitis. It's quite common. About 20% of the general population can get affected with eye allergies. It occurs when the eyes react to an allergen. It produces a substance called histamine to fight off the allergen. It can also be associated with nasal allergies, leading to itchy, stuffy nose and sneezing. Remember, eye allergies do not spread from person to person. So what causes eye allergies? An allergy occurs when the body's immune system reacts to an allergen. When the allergen comes in contact with your eye, there are cells called as mast cells which release histamine and other substances. These are the chemical mediators for allergy to fight off the allergen, leading to symptoms of allergic eye, like red, itchy eyes. Some people inherit allergies from their parents. Let us look into the symptoms of eye allergies. It can cause red, swollen, or itchy eyes. As you can see in the picture, it depicts all the symptoms and signs of eye allergies. There can be burning or tearing of eyes, excessive watering, sensitivity to light, foreign body sensation. There can also be pigmentation and thickening of the lid margins. This is because of excessive rubbing of the eyes. It can also be accompanied by nasal allergies, leading to stuffy, itchy nose, sneezing. Also, there can be headache, itchy and sore throat, or coughing. These are the general symptoms of allergies associated with the eye allergy. The person can also have asthma or eczema. Eczema is the skin allergy or the allergic dermatitis. Let us look into the common allergens which can cause allergies, which we can get exposed to in our day-to-day life. Most common being pet dander, dust, or the dust mites. It can be the indoor dust as well as the outdoor dust. The dust mites can be even inside the house, like in the curtains, carpets, mattresses. These are the common sources. Pollen from grass, trees and ragweed, smoke, perfumes and cosmetics, molds, some food and medicines or drugs can also cause allergies. This has to be identified by the individual and know what he or she is allergic to. If you're allergic to any kind of medicines or drug, please make a list of those medicines so that when you visit your doctor, you will let the doctor know that you are allergic to these medicines so that that will not be repeated or prescribed. So you have to be careful. Always carry your list of medicines you are allergic to. Okay. Insect bites and stings can also cause allergies. Even preservatives in some eye drops can cause allergies. So that is the reason don't self-medicate or buy over-the-counter medications and use it by yourself for any kind of eye problems. Let us look into some common terminologies. What are seasonal allergies? Seasonal allergies happen at certain times of the year. Usually early spring through summer and into autumn. The triggers being allergens in the air, commonly pollen from the grass, trees and weeds, as well as spores from the molds. There's another term called as vernal keratoconjunctivitis. This is also called as spring catarrh. As the name suggests, mostly happens during the spring season. It's a severe type of seasonal allergic conjunctivitis. Patients can also have asthma or eczema. Symptoms typically occur at the same time each year, but most patients eventually do grow out of this problem. Symptoms are commonly severe. As you can see in the picture, there are some signs which are showing a severe allergic reaction in the eye, like dilated blood vessels and a jelly-like ring formation around the black portion of the eye, that is the cornea, severe red dust mites, feathers in the bedding, and animal dander or pet dander. This is something we get exposed to every day in our day-to-day life. Other substances like perfume, smoke, chlorine, air pollution, cosmetics, and certain medicines also can cause these perennial allergies. There's another condition called as atopic keratoconjunctivitis. In this, there is a history of allergic dermatitis or eczema. There's a strong genetic predisposition to this condition. It can cause intense bilateral itching of the conjunctiva, eyelids, and periorbital skin. Excessive tearing, burning, photophobia, that is light sensitivity, and blurry vision. In this type of allergic conjunctivitis, the cornea or the black portion of the eye gets affected severely. It also causes excessive mucoid discharge, often described as rope-like discharge. So how do we diagnose eye allergies? When you visit your eye doctor, detailed history, including the medical history, family history of allergies, all these will be taken. On examination, we look into some signs of allergies like dilated blood vessels or swollen blood vessels, a lot of inflammation in the eye. There are other signs we look into for the eye allergies. If the eye allergies are occurring frequently, then we also consult the allergy specialist or immunologist and do some skin and blood test to see what the person is allergic to, what are the common allergens which the person might be reacting to. This will really help in the treatment of the eye allergies. Along with the eye medications, parallelly, if this treatment goes on, it will really help in giving relief to the symptoms. So now let us look into the treatment of eye allergies. The key to treating eye allergies is avoid or limit contact with the allergen. This is the most important thing if you want to keep your allergies under control. So how can we avoid allergens? If you're allergic to pollen, avoid going outdoors in the mid-morning or early evening. This is the time when the pollen count is highest in the air. Avoid being outdoors when the wind blows pollen around. If you're not able to avoid, wear some sunglasses or eyeglasses. This can help prevent pollen from getting into your eyes. Also, you can wear a mask to prevent inhalation of the pollens. Keep your windows closed and use air conditioning. Don't use window fans as they draw the pollen and other allergens inside. Keep your air conditioning units clean so they won't cycle the allergens inside. Especially in high humid areas, the humidity can cause molds to grow. This is also a very common cause for allergies. Humidity level should be around 30 to 50%. Clean high humidity areas like the kitchen, basement, bathrooms often. Also, dehumidifier can be used in such places. Dust mites. This is very important, you have to take care of. Keep the dust mites away from your skin and bedrooms. How? You can frequently vacuum clean the curtains, mattresses, carpets in your house. Use allergen reducing covers for your bedding and pillows. Wash your bedding frequently with hot water. This can be really helpful. When cleaning floors, use a damp mop or rag. Also, you can cover your face with a mask. Consider hardwood or tile floors instead of carpeting, because all these carpets and heavy thick curtains can draw a lot of dust in them. Pets can be a source of allergy. So if you're allergic to pet dander or pet hair, avoid pets getting into the bedroom, onto your bed and all that. And always wash your hands or change your clothes after touching a pet. Avoid rubbing your eyes. This is very important. As I told you about the itch, rub, itch cycle. Whenever you have itching, you tend to rub. Rubbing releases a lot of chemical mediators like histamine and all these things in the eyes, which can further increase your itching. And this itch, rub, itch cycle goes on. So do not rub your eyes. Let us look into the definitive treatment of eye allergies. We prescribe some eye drops like artificial tears or the lubricating eye drops. How do they help? They basically wash out the allergens from the tears. They keep the tears eyes more moist and lubricated. Antihistamine or mast cell stabilizers. These are the medicines which will reduce or the release of the chemical mediators in the eyes like histamine and all these things. They are safe medicines, no side effects with these medicines, but do follow your doctor's advice to follow the course of the medicines. Next is corticosteroids or the steroid eye drops. These are used generally with severe allergies. Always follow your doctor's advice for the steroid. Don't self-medicate. Your doctor will give a particular course for these medicines, so do follow the doctor's advice. Oral antihistamines or in the form of tablets. This, in addition to reducing your eye allergic symptoms like itching, the general symptoms like itchy, stuffy nose, all these you'll get relief from these. Decongestants, these are also eye drops with or without antihistamines. They basically constrict the blood vessels in the eyes, but do not overuse them, not more than few days. Because once you overuse and stop these kind of medications, there can be rebound redness in the eyes. So they just give a temporary relief. Immunotherapy shots. So once the allergy specialist or the immunologist does the skin test and blood test and know what you're allergic to, small doses of these allergens are administered so that you develop immunity against those particular allergens. Over time, you will stop reacting to these allergens. And the simplest thing you can do at home is give cold compresses, maybe once in the morning and once in the evening or before bedtime. You can also refrigerate the eye drops. This will give some cooling and soothing effect to your eyes. You can keep it in the fridge door and then use. Here, I would also like to mention few other causes of itchy eyes, which commonly you can come across. Dry eyes. Dry eyes also can be a cause for itchy eyes. It can be age-related, increased screen time. So it's very important for you to maintain good hydration. You can use some lubricating eye drops. If the symptoms persist, then you can meet your doctor and take the medical advice. Meibomianitis. These are plugging of the oily glands in the lid margins. There are about 20-30 oily glands in for all of us in the lids, in the lid margins. Meibomianitis, in this condition, there will be plugging of the openings of these oily glands. So there is no good lubrication to the eye. This can also cause itchy eyes. So you can give some warm compresses for this condition. If you notice that the small yellow pinpoint pluggings in your lid margins, then you can start giving warm compresses to the eyes, maybe once or twice in a day. That will really help in opening up the pores and smooth flowing of the oil from these meibomian glands, and gives good lubrication to your eyes. Lubricating eye drops also helps in this condition. But if the problem is severe, then it can cause some inflammation in the eye. Then you have to meet your doctor and take the advice. Blepharitis. This is also a very common cause for itchy eyes. Here, as you can see in the picture, there can be flaky deposits on the lid margins. So the simplest and the safe treatment, what you can do at home is use baby shampoo for lid scrubs. You can just dilute the baby shampoo, wash your lids with closed eyes, and just wash with plain water. That will remove those flaky deposits and to some extent give relief from the itching. But you will need some antibiotic eye ointments, which your doctor will advise. Now let us look into some do's and don'ts for your eye allergies. You can wash your eyes and face with clean cold water. Wear glasses instead of contact lens to reduce irritation. So patients with eye allergies may not be very tolerant to contact lenses, so you might have to limit the contact lens usage. Wash your hands before applying ointment or using eye drops. You can place cold compresses on your eyes. Always wear goggles while taking a walk or when you go outdoors to avoid the dust and pollen exposure. What are the don'ts? Don't rub your eyes. Avoid wearing eye makeup on a regular basis. Don't share eye makeup with anyone. Never wear another person's contact lenses. Don't self-medicate or buy over-the-counter eye medications and use. Always consult your doctor and take the right treatment. I hope now you know various causes for itchy eyes, more so about eye allergies. Follow the tips and remedies, the do's and don'ts I have explained to you, and take care of your eyes. If the symptoms persist, do take medical advice and get your problem treated. With this, I would like to conclude today's session. We will meet soon with many such informative topics. Do subscribe to our YouTube channel for many such educational videos, and share the knowledge with your family and friends, and spread awareness among everyone. Thank you.